I'm so excited to speak to our guest today. She's an aesthetic RN in the Atlanta area and has been practicing aesthetics for 10 plus years. She has created her own PRP system and now she's taking the market by storm. Please help me to introduce aesthetic RN, Renee.
Hey, how you doing?
So Renee, thank you so much for joining me today.
Thanks for having me.
No problem at all. So I wanted to ask you one of my first questions. How did you get started in the aesthetic industry?
Well, the honest truth is, I was interested for myself. I was working in the ER at the time. I had a consult, realized couldn't afford it, so what better way to do it? I got into it. I started working for a plastic surgeon, and he became pretty large in his industry, so I ended up doing all the injectables. And I have art background, music, and so it was really kind of a right-brained, I guess, epiphany. And so when I started doing it, I realized I was really good at it. And I started seeing like problems in the industry, like overfilled faces, filler face, things like that. And I know because it happened to me. So I was looking for something that would make me look younger, my skin, but not make me look overfilled. So I started studying PRP, and I really, worked with it over the last 4 years and really perfected it. I've been doing it about 10 years injecting. But my perfection of the PRP, it took me about 3 years to perfect it, and I've been doing it for about 4 years now. And I really think it's the cutting edge to healthcare, medical care. I think it's better for your face. It looks better. It's more natural because you're actually rejuvenating skin cells. You're not just filling your face with a foreign object.
Nice. That's really great. So I know you said you started in the ER. Now a lot of nurses I speak to, they're like, you go from one industry to the next, and it's like, aesthetics might not be the right field for you. How did you know, like coming from the ER, that you could take on that?
Well, like I said, I had an art background, so in aesthetics, you really need that right-brained eye to look at your client. There's left-brain injectors out there that, draw a lot of lines and do things like that, but I really do it off the eye. I kind of look at somebody's face. I used to sculpt a lot of pottery, and the face is kind of like clay, really. So when you're using a filler, it's like the same medium as clay. You just have to look at your angle. So it's just art, really.
Nice. So usually, I usually work with a lot of NPs, nurse practitioners, physician assistants, to place them because they're usually able to inject all over the U.S. As an RN, tell me a little bit about that. How challenging was it to get into aesthetics, and how did you know that you can inject in this area?
I just kind of fell into it. Like I said, I was working for a plastic surgeon. He was really good at what he did, so he didn't have time for the injectables. He trained me. I took a lot of training courses. This didn't happen overnight. It was really like, I started with Botox, got really good at Botox, then I went to lips, then I went to cheeks, then I went to jaw lines. Then we started getting hair restorations, and then I started doing the PRPs and stuff like that. So it was really a gradual build. That's why I say, even though I've been injecting for 10 years, I've really only been doing PRP for 7. It took 3 years to really study it, understand it, and perfect it. And for the last 4 years, I've considered myself an expert on PRP. You can grow hair back with PRP. You can resurface skin. You can get rid of scarring, stretch marks. Really, anything to do with skin, you can rejuvenate with PRP or stem cells.
Amazing. So would you say you're like a master of PRP?
I would. It's not just the process that I put the PRP, like the blood through, it's how I inject it. I'm not just spraying it on the face and microneedling it. I'm actually injecting it. I use, like different layers in the dermis. I learned about the bone structure and muscles and how PRP works, on top of the bone and in the muscle. It does great too. So there's a lot of purposes that you can use PRP that don't include medications or foreign body fillers or neurotoxins like Botox or Dysport.
Nice. So when you're seeing patients, what do you usually choose more? Like, are you more holistically, or do you usually choose American medicine?
Well, I think it's important to be balanced in anything you do in your life, and the same thing is true for aesthetics. So it depends on the client. Depends on if they've lost structure in the cheek or the jawline. Then I'm going to go for a filler. I like Radius a lot. It's a good bone filler, and it pops your face up from underneath. Then I just do the fill-in with the PRP and treat the skin. So everybody's different. I like PRP, and I like people to get into PRP young, because the younger you are, the better it works. And at age 30, we stop producing collagen, and that's what makes us age. So what PRP does is it actually replaces the loss of collagen production that's happening. So it's like you're rejuvenating your skin every time you do one. And you know, I've had clients that I've been doing for years, and they haven't aged a day, and they don't look overfilled. And the problem with fillers is you're going to get a filler in your cheek 1 year, and then next year you're going to need that same filler plus another filler because you're continuously aging. But if you're doing things like PRP, you're just rejuvenating the skin, keeping your elasticity, keeping the collagen. It's a much healthier and more natural way to look.
Wow, that's interesting. I learned something every interview I do, and I did not know your body stopped producing collagen at the age of 30. That's interesting. Wow.
Unless there's trauma, which is why they do like microneedling and stuff like that. Induce trauma to induce collagen production. So we're kind of doing the same thing. We're just using PRP to do it. And I use trauma as well with the way I use the needle to insert it.
Nice.
So you get kind of a double procedure.
Nice. That's really good. That's really good. So, like I was saying before, nurse practitioners, physician assistants, I usually focus on more. What stipulations or what limitations does an RN have versus, I would say, an advanced practice provider?
There's just not really too many things that we can't do that the providers can do. We have to get orders from our physician, and our physician has to take a look at what we got in front of us. And so we really depend on our physicians as our backup. But you know, I've been doing this a really long time, so my physician has a lot of trust in me, and I work pretty independently. But I think it's not about the degree as much as it is about the technique, the safety, and the knowledge and experience. You know, a lot of people will avoid doctors now because the nurses are doing this more, and the doctors are doing surgery, you know, so that's their bread and butter, so they're going to be in the OR more. Your nurses, your MPs, they're going to be doing the injectables more because that's our lane, so that's where we're at. So we have more experience in it. So I think it's not really about the degree as much as it is about the, you know, the technique and the experience. You know, I have a 10-year ER background. I did 8 years in the OR. I was a nurse administrator for plastic surgery OR. So I think I'm just really well advanced because of those backgrounds. Whereas another injector might be a nurse practitioner or a physician who just comes on the scene a couple of years. They might not have as much experience, you know, so their work might not be as good. But you could have another injector that's been injecting 10 years and has horrible safety practices, doesn't care about the customer, and you know, is only worried about that bottom dollar. So you have to be really careful in this industry.
And I would agree with that. You know, just because you are a provider, no matter if you're RN, PA, or NP, you really do have to practice your craft. You know, and training is so important. Like we said that earlier, it's such important because you're providing whatever skills, whatever knowledge. In case something goes wrong, you're there to provide that to your client.
Absolutely.
So if you're not educating yourself on a consistent basis, then you're not giving the value to your client that they need.
Right.
Awesome, awesome. So tell us a little bit about, I know you said that you went to school and become an RN, you worked in the plastic surgery industry, and then you got more into injectables. Can you give us a little bit of advice on what maybe a new grad RN could do to get into the aesthetic industry, or more so, any tips for them?
To be honest, I would look for a plastic surgeon to get under, because you want to have somebody that's in the field, because the trainings aren't really that great. You really need the hands-on experience. You need somebody kind of guiding you, watching you, just to have that backup. And you know, things happen, so you want to make sure that you know what's going to happen before it happens, so that you can stop it from happening. But I think that just safety is the biggest issue that you need to really, you know, watch. And you have to talk to your clients. You have to know what they want. A lot of people go in there and think, oh, they're getting lips. Okay, well, what kind of lips do they want? I need a picture. Show me what your brain is thinking that you want. And I'm going to tell you, like, girl, you can't get those lips with one syringe. Or we can get those lips, but it's going to take a few syringes, you know, sit in my chair. You don't want to rush this. This is something you don't want to go in and just do 100 syringes in one day. first of all, your lips can't handle it and they won't look good. So slow and steady is the pace. That's what I would go by.
Awesome, awesome. What tips or what knowledge would you say you learned the most, or the hardest lesson you learned the most in the aesthetic industry?
I would say, as far as like,
so you've been working here a long time in the industry. I'm sure you've had downfalls, you had upfalls. What was something that, you know, could have been preventable, or someone could have taught you early on in life that would have helped you in your career?
I think really understanding the muscles in the face and the anatomy. So before I really had that strong anatomy underneath my belt, you know, I did a cadaver class. I also went out to Vegas and trained at the 𝐥𝐤𝐤𝐤. Thank you, Dr. J, for that. I went down to Orlando, we trained down there. And watching other physicians, that's really your bread and butter, is watching other people's techniques and learning them. Because the off-label stuff, it's like you feel kind of handcuffed because you don't want to do something that's off-label and not have somebody there right there to help you train. That's why I say for RNs, you really should go under a physician when you first start coming into the field until you get strong enough, and then you can venture off and do med spas. But I would never recommend a brand new RN going into a med spa because there's too much autonomy there. You really need somebody to kind of guide you through it.
Nice, nice. And I can agree with that. Med spas, you know, usually a lot of higher clientele. They're coming through a lot more. In the plastic surgery industry, the doctor is standing right there. So
Right.
if something goes wrong, like you said, they can assist.
It's just a good place to learn. You know, it's a good place to start getting your comfort, and you know everything else will come. And then the continual training is a big thing too. A lot of injectors, they just start, you know, injecting and then they just stop. And I can tell by their work. You know, they're not, you know, doing Russian lip flips. They're not doing PRPs. They're not doing threads. So those are all things that you got to keep up with because people are going to ask you for it. A lot of the new things that I've done, literally my clients are like, hey, do you know how to do this? I don't right now, but give me a minute, I'll learn. So I'll go take a training class, learn how to do it, and you know, next thing you can master something or hate something. Like, you know, it just depends on the injector and what the eye likes or what the people like or what they want.
Yeah, so it's really about the eye, each person.
Yeah, I think it's about the eye and what the client wants, and be able to communicate that to the client to be able to understand what you're going to do in your head and make sure that you're meeting their expectations. Or if you can't meet their expectations, let them know. You know, your injector should be teaching you. They shouldn't just come in and shoot your face up. They should be explaining what Botox does, how long it's going to take, when does it take effect, and what to look for. Are your eyebrows going to peak? Some eyebrows peak, and that's because a good injector is not going to go near those eyebrows because once you drop an eyebrow, you're done. 3 months, you're going to be stuck like that. So a good injector is never going to take a chance with your face, ever. So you have to know, like, hey, if I got an eyebrow that's a little higher than the other, just come back, we put a unit here, you're off and out the door. But you're not sitting there with an eyebrow down for 3 months.
Have you ever had to turn away patients, I guess?
Yeah.
Really?
They get mad at me. You know who you are. I don't turn you away or I don't tell you no because I don't want to do it. I do it because I don't want you looking ridiculous and going out in the street and you think it looks good because you might have bi-dysmorphic disorder or you might not feel good about yourself or you haven't figured out how to love yourself all the way yet. So then you go out in the public and you look overdone and you look ridiculous and they're going to say, oh, you look great, where did you get your stuff done? And they're going to say, oh, I went to Renee, and they're going to go, girl, don't go to Renee, did you see her face? So it's not just your face, it's my art too. So if I feel like you're overdone or you're not going to look good, I'm not going to do it. And you could go somewhere else, and that's your prerogative to do it. But when you sit in my chair, your face is just as much my art as it is your face. So let's just come to a compromise.
I definitely understand that.
Yeah.
It's really about reputation, especially in this industry.
Yeah.
Because how you perform with one patient really defines who's going to come to you, who
Correct.
they're going to refer you to, who they're going to see on Instagram or whatever
Right.
site they're posting on. So I agree. So Renee, being so experienced, being in the aesthetic industry for so long, who do you look towards as a mentor or really to gain more knowledge?
Well, I do training classes and those kind of things, but if I was to look at one specific injector, so I love threads, and there's a girl in Florida, her name is Injector Jess, shouting you out. She's phenomenal. She's good at fillers, but she is a maniac at threads. So I couldn't figure out how to do the eyebrow thread. I watched her page and like 2 seconds I was able to do it. She's really good at what she does. She doesn't mind sharing her knowledge, and I appreciate injectors like that help the rest of us when we're starting something new.
Yeah, no, I can definitely agree to that. What training? I know you mentioned training several times. What training could you give to other people that they can check out, or even like I would say Instagram pages? I know you said Jessica, but anybody else that you would say people can check out?
Yeah, so you can check out AFL Beauty. We are actually doing AFL Beauty Academy, and I'm going to be teaching PRP. So we will be in New York, Miami, and LA, and I think Atlanta, and I'm not sure exact dates, but we'll get them for you. But yeah, AFL Beauty, Renee Dries official, RENEE DRIES official with 2 F's, and that's about it.
So Renee, tell us, what do you have planned for the future? Tell us a little bit about what your goal is for your industry.
So my goal is to become basically an injector trainer. I saw a lot of problems out in the industry, so I want to set the record straight and get people on the right way to do this. Not using overseas products. That's a big no-no. So if you're using overseas products, you will get caught, and it's not fair to your clients. So stop doing it. And I want to teach the new injectors coming out the basics, and I want to be able to teach the off-label things so that people aren't just out there experimenting. Because to be honest, I had to do a lot of experimenting. Thankfully, I was under a doctor's eye doing it. But I want to take the danger out of it so that we can teach safety in it. And I also want to open up my own franchise, hopefully AFL Beauty franchise. Fatima.
Awesome. Now, I usually work in the big areas like LA, Miami, New York, but Atlanta is growing and growing fast.
It is.
Tell us about that. How is the industry growing in this area?
So I'm originally from New York. I moved down here about 17 years ago, and I've seen the industry explode, and I've seen a lot of changes over the years as well. So I would say Atlanta is like the new LA, the new baby Hollywood. Music just blew up down here. Now the film industry is blowing up down here. So of course, when that happens, you're gonna get the people that need this stuff, the stars, the celebrities. I've done quite a few celebrities. Thank you guys. I appreciate your support. And I do it, and I think they come to me because they know I'm going to give them perfection. They don't have to worry, is she going to do a good job? I have to go on film in 2 days. I have a girl that, Elizabeth Hassel, she's a model, she's amazing, she's a mom. But she would come to me before a photo shoot, and I would be scared to death because I'm like, oh my God, what if you bruise? She's like, I won't, you're fine, just do it. And she was one of my clients that gave me that, that confidence to just go ahead and do it. And, so your clients give you confidence along the way, and their great outcomes and their happiness and their support as well. So thank you to my clients. I really love them. Everybody will tell you. And I'll tell you a little secret.
Good.
So because I came from the ER and I've seen a lot of things, a lot of women that come to your chair, they're broken. They're broken by their husbands, career, the world, children, whatever. And they get lost in the world. So when they come to us, they're looking for something to make them feel better. So those women I identify immediately. And I'll hold their hand, I'll pray with them, I'll talk to them, I'll tell them my stories. Half my clients know my whole life. Because sometimes when you can just relate to somebody, it opens the door, just as females, as women, Sometimes my closest friends are my clients. So you have to understand this isn't just about aesthetics and beauty. There's a psychological aspect, and if you don't address that psychological aspect, and if you don't identify people with body dysmorphic disorder and help them, you're wrong. It's unethical. I know a lot of injectors will just inject these girls and inject them because there's something wrong with them psychologically. So we're supposed to recognize that, and it's up to you to do that to your clients because it's gonna come back to you. It will come back to you in an injury or something. Thankfully, that's never happened to me, knock on wood. But, I'm safe, and I educate my clients, and I care about them. So that's really something that I think injectors are missing from the industry is they're just trying to see as many clients as they can throughout the day. They're not taking the time to get to know the human being that's in that chair. And that's part of our job as nurses. It's not just, we're not just doing, a service. Anybody that does hair and makeup, they're going to tell you the same thing. My hairdresser knows my whole life story, so makeup too. But, that's the industry we work in.
Yeah, nice. No, I can definitely agree. Now, you work with a lot of celebrities, a lot of models down here in the Atlanta area. Tell us, I know a lot of injectors I speak to don't get to work with a lot of different high-profile people. How did your marketing go? Like, tell us how you got to that level.
Well, it started with Dr. 𝐥𝐢𝐤𝐞. I started working in his plastic surgery office, and we got a TV show, out of it, and we did that. And then I just started doing different people. They started coming to me, and they supported me. It was just nice to have that female support, So I think you as a person comes off to the people that you're working with, and people will support you because they believe in you, believe in what you do. So.
Now, I did an interview a couple weeks ago with a male provider, and he was saying that men are starting to get more Botox are coming in. Mm-hmm. Tell us what your perspective is in this area.
I love it. I love that the guys are coming in, because I will be in the grocery store and see the guy's brow, and I'm just like, you can see so much better if we just put a little Botox in there. So I love that the guys are getting more comfortable with it, and I love the wives for bringing the guys in. A lot of, the guys never used to do this stuff, but the wives are looking good, so they want their men to look good. So yeah, it's not like, just a girl thing anymore. Do I love my ladies? Of course, but boys, come on over. I've actually done a lot of guy PRP for hair and face because it's more of a natural look. So they're about the PRP.
So no more bosley.
No, we don't need that. All we need is just PRP, inject it into the hair. You can get hair growth within 4 months.
Nice.
Yeah, it's pretty cool stuff.
Thank you, Renee, so much for joining me today and talking a little bit more about your passion and your industry. Tell everybody where they can find you at and how they can get in contact with you in case they want to use your services.
So I'm in Atlanta. I'm at AFL Beauty Bar. You can also find me on Instagram at Renee Dries Official, ReneeDries Official with 2 Fs. And hopefully we'll see you soon.
Awesome. Until next time.